Hi everyone, my name is Nicole. I'm from Austrek and I'm here with Liam, who is a student at Griffith and he's a PhD candidate.
Hi everyone, I'll just bring up my slides here. Okay, thanks Nicole. So just to further introduce myself, my name's Liam King. I'm a PhD candidate at the School of Pharmacy and Medical Science at Griffith University. So a bit of background of my pharmacy journey and how I've come to where I am today. So back in 2012, I first graduated from the Australian National University in Canberra with a Bachelor of Science. And then in 2013, I moved up to the Gold Coast. And I wasn't quite sure as to what I was going to do. Even coming out of school, I did well in school, but didn't know what I wanted to study or what career path I wanted to take. And I enjoyed science, so that's why I took up the Bachelor of Science at Australian National University. And then when I came to the Gold Coast, I was trying to find work in different avenues within the science field. And I actually majored in chemistry and immunology in my science degree and had a look at what Griffith University had to offer. And based on this, they had a fairly extensive pharmacy program. And I thought this would be a good avenue to explore given my past studies in chemistry and immunology. And my interpretation was that pharmacy is kind of where these two areas meet. So I had a look online and found that Griffith University offered a prior learning pathway into the Bachelor of Pharmaceutical Science, which meant that with my prior learning, I could get some credit for the courses I'd already done. And I was able to then go in and do a couple of summer courses and complete my Bachelor of Pharmaceutical Science in 2014. From the moment, I guess, from my first summer course I did at Griffith University, I was really engaged with the lecturing staff there and the content in the course. And from there, I guess my interest in pharmacy grew, and the passion for that area of science was really, I guess, became evident in my career path as to where I ended up. So after completing that Bachelor of Pharmaceutical Science, I then applied and got into the Master of Pharmacy program at Griffith. So this was, at the time, it was a 1.5-year program, which then enabled you to get the professional qualification to become a pharmacist. And as part of that, we also did some research projects. That master's program's now turned to a 2-year program and has quite an extensive and exciting research component to it. So it's a really beneficial degree and sets people up really well going into the pharmacy profession. So in 2016, I completed that Master of Pharmacy. And then in Australia, we go into an internship year where we have to work as a pharmacy intern before we're fully registered. And throughout that intern year, so I also began to do a Master of Medical Research as a part-time student. This was a 2-year degree at the time, and I was doing it part-time alongside working. And I sort of just rolled through into this from the Master of Pharmacy through the different lecturers and academics within the pharmacy school showing interest in my learning and wanting me to continue to be involved in that research space. So we did some really exciting work in that Master of Medical Research. We looked at anti-inflammatory drugs and how they impact prostate cancer and their ability to potentially improve the current treatments of prostate cancer. So I completed that Master of Medical Research in 2018, and then in 2019, I applied and was accepted as a PhD candidate at Griffith University. So I'm currently still undergoing that PhD candidature, and I'm doing that part-time at the moment, and hoping to complete that within the next sort of 2 to 3 years. So I guess my time at Griffith University has sort of just rolled one into the other, and I think the environment within that pharmacy school is what's really kept me engaged and learning, and wanted to keep that contact and continue down this research pathway. So alongside my studies, I also, in my Master of Pharmacy year, during my Bachelor of Pharmaceutical Science, I was employed at Ramsay Pharmacy as a student, and then went through to become an intern pharmacist there, and then a clinical pharmacist and an oncology and clinical trials pharmacist. And finally, my current role is the clinical trials pharmacist lead for Ramsay Pharmacy Australia. So I guess my Griffith University pharmacy education really set me up well to transition through these different areas within the Ramsay Pharmacy business, and also the Master of Medical Research was really beneficial in me gaining those further qualifications to go through and be a clinical trials pharmacist and managing to get that lead position for Ramsay Pharmacy. And my PhD will also further enhance that research learning and be really beneficial for that pharmacy research career. So a little bit about my PhD project at the moment, which is quite exciting and interesting. We're looking at prostate cancer. So we're looking at repurposing certain drugs that are currently available for different disease conditions and reusing them in the treatment of cancer, or more specifically prostate cancer. So the reason that our group focuses on prostate cancer is that it's the fourth most common cancer worldwide, and it's the second most common cancer in men. And in Australia, there's over 16,000 new cases diagnosed each year, and it's the second leading cause of death in Australian men. So it's quite a prevalent cancer around the world and within Australia. So it's an area that our group is really focusing on to try and enhance the treatment methods. So currently, there's a number of different treatment methods for prostate cancer. Our group at this stage is focusing on what we call the androgen-dependent prostate cancer. So that's a localized prostate cancer, or the earlier stage prostate cancers before they become and transition and become more aggressive. So there's watchful waiting or active surveillance. So that's for disease that's very low grade. The best way to treat that rather than with invasive treatments is just to watch and keep an eye on it. Potentially there's option for surgery, so surgical removal of the prostate gland. Androgen deprivation, which is what we do. Androgens are a type of hormone that prostate cancer relies upon to grow. So we essentially starve the prostate of those androgens and starving it of its food that it needs to grow. And the other option is radiotherapy, where we target the prostate cancer with different radiotherapy methods and aim to kill those prostate cancer cells. So which treatment is chosen depends on a number of things: the classification of the disease, the stage and the grade of the disease, so how severe it is, the severity of the symptoms as well, the patient's age, and any other comorbidities that might affect their treatment. So for example, patients that are older and frail, we might not want them to undergo surgery, so they might be a candidate for radiotherapy instead. So this slide just is outlining that whilst we have these treatments that are relatively effective in treating prostate cancer or early prostate cancer, there's a large number of side effects and adverse outcomes that come along with these. And there's a need for us to further refine and enhance these treatments to reduce the impact on the quality of life of many patients. So for our group, one class of drugs we've been focusing on are the alpha blockers. So these are traditionally used to treat people with high blood pressure, or sometimes in men that have enlarged prostates that are not cancerous. And there's a number of different alpha blockers within that drug group. So for example, we have terazosin, prazosin, doxazosin, also naftopidil and tamsulosin. So whilst they're all within the same alpha blocker group, they have a number of different chemical structures, which also changes their ability to impact cancer cells. So some past work from our group, we found that terazosin, prazosin, and doxazosin have cytotoxic, or the ability to kill androgen-dependent and also androgen-independent prostate cancer cells. So those androgen-independent cells are the ones that are more advanced and don't rely on those androgens for growth. And we found that a structurally similar drug to these, what we call quinazoline structured alpha blockers, naftopidil, also produce these cytotoxic effects. However, interestingly, tamsulosin, which is a sulfonamide derivative and one of the most commonly used alpha blockers in men with enlarged prostates, did not have this same cytotoxic effect. Following on this, we started to focus on the quinazolines and specifically prazosin and doxazosin within the lab, and we exposed prostate cancer cells to these drugs and saw how they affected the growth and survival. And it was found that prazosin, especially as well as doxazosin, had quite a profound effect on the cell survival of the prostate cancer cells. And we decided we continue to focus on prazosin because in Australia, doxazosin is not available to patients. whereas Prazosin is. So that became our drug of choice to focus on and hone in on for further studies. So following that work in the lab, we switched to a bedside model and we looked at how these drugs actually affect individual patients and real life human patients. And our group conducted a retrospective patient data analysis. So this is where we look at patient medical records and we go back in time and review what these patients were doing during their radiotherapy treatment. So we took a list of all of the patients that were taking Prazosin and tamsulosin during their radiotherapy for prostate cancer. And then we looked at how long between the time when they had radiotherapy and when their prostate cancer returned, and looking for any difference between those people that took Prazosin, tamsulosin versus those that didn't, in how long it took for them for their cancer to return. So it was the Prazosin group had really amazing results. We found that at 5 years, only 8.8% of patients had relapsed, their cancer had relapsed. This is compared to 34.5% in the control group, so those that weren't taking any alpha blockers during their radiotherapy treatment. And interestingly, tamsulosin, as we found with our lab-based studies, seemed to have no real effect on overall survival or the recurrence of the prostate cancer. So once again, this sort of further confirmed that Prazosin was the drug that we needed to focus on and look at potentially for repurposing into prostate cancer. So our next stages, so where we're at now. So my PhD project, we're focusing on transitioning this into a prospective clinical trial. So this is where we put patients onto the drug and monitor them going forward rather than looking back in time. So this study, you're doing a feasibility study, and this is titled A Feasibility Study of the Repurposing of Prazosin to Improve Treatment Outcomes in Men Receiving Radiotherapy for Prostate Cancer, or the acronym we've given that study is the MiniRAP 00 study. So participants are going to take Prazosin at escalating doses during their radiotherapy for prostate cancer, and we're aiming to have 30 participants in this study. And quite excitingly, this is going to be the first ever clinical trial that's explored the combination of Prazosin and radiotherapy for men with prostate cancer. So it's a really exciting field that we're getting into and potentially being the first researchers to show prospectively in human patients that this combination works and is effective for prostate cancer. So the potential impacts of this trial, we're looking to guide us to have a bigger, large-scale clinical trial after we've shown feasibility with these 30 participants. So then we're looking to stretch this into hundreds of patients, and we'll have a placebo-controlled trial to really strongly show the efficacy of Prazosin when combined with radiotherapy. So this has the ability to impact a large group of men in Australia. Prostate cancer is very prevalent. So it's 16,000 men each year are diagnosed. It makes up 22% of all male cancer diagnoses in Australia, which is huge. And 12% of all male deaths last year came from prostate cancer. So if we're able to impact prostate cancer early, improve our treatment outcomes, and slow the spread or the progression to the more aggressive, lethal disease, prostate cancer, we're able to really have an impact on these men and extend their life and extend their cancer-free life and quality of life. So thank you for listening today. And I guess just to summarise, my time at Griffith enabled me to develop an interest in pharmacy, but also push that further and go into research. And now as a pharmacist, as a health professional, it's really rewarding to be able to impact patients' lives with these discovering of new treatment methods, improving the cancer treatment, and really having an impact, not just working within the healthcare system. So thank you.
Amazing. Thanks so much, Liam. We do have one question here. I'll just read it out to you. Can you just tell everyone a bit more about support that you've received from Griffith in your PhD and how everything works? Yeah.
Yep. So Griffith have been very supportive in PhD, and I guess the really important thing for me, they've been very flexible in that I'm working full time as well as conducting this PhD. Not even every week, every couple of days, I'm in contact with our supervisor, and the academics at Griffith have really, to me, it's not a teacher-student relationship. It's very level field. We can talk about anything and everything and anything. And we have also sort of developed that rapport right from when I was an undergraduate back in 2013. And the team, I guess, around the Griffith Pharmacy, they're all very personable. I know almost all the academics by name, and they would do the same for me, even back in my undergraduate degree, which was really appreciated. I think coming from Australian National University, which is a fantastic university, they have great research, great programs. But Griffith really had that extra step of having a more personal relationship with the students, which I think was really, really valuable. And even now, Griffith values the collaboration between the different partners. So we collaborate on a lot of our research projects through Ramsay Pharmacy and Griffith Uni. We work with Bond Uni, and we also work with a number of the oncology clinics and radiation clinics around the Gold Coast. So it's a very holistic approach, I think, to the idea of pharmacy and the research world, and very accommodating and flexible.
Amazing. Well, thank you so much for sharing your research and your story. We are at time now. So if anyone has any questions, will you be in the chat group after this?
Yeah, I can be. Yep.
Perfect. Okay, great. Thanks so much, Liam.
No worries. Thank you.
Take care.